Just this past Sunday, in the Plain Dealer, there was an article that talked about the analysis of the Affordable Care Act, and combined with the decision in Ohio not to expand Medicaid, that was indirectly responsible for the recent cuts that were announced by the Cleveland Clinic. Similar cuts have also been announced by other large medical centers, including Vanderbilt. Do you anticipate these similar cuts to occur at regional and local hospitals here? And if so, how are the business and employees of those institutions going to be affected?
Yeah, just to sort of set the record straight, it was interesting how this was interpreted by Fox News. What we announced is that we were going to offer early retirement for 3,000 people at the Cleveland Clinic, and it was voluntary. We did not tie that to Obamacare or to Medicaid. We said that there was a whole series of things that I said earlier that was reducing the income. I had an opportunity to sit down with Valerie Jarrett and tell her that this was coming, and I think it's going to affect hospitals across the entire country. And I don't think any hospitals are going to be immune to having to deal with these decreases in income. So I think it's going to affect everybody, every hospital, every place. Every CEO of every hospital I've talked with is trying to figure out how he's going to deal with it and talking about people.
The concept of value-based purchasing of medical services and accountable care for reimbursement now represent new forms of healthcare delivery that you addressed. How will the clinic, who takes care of some of the most sick and complicated cases, be able to thrive in this new reward for good outcomes and penalize for bad outcomes?
Well, first of all, I have to tell you that I think that probably all the healthcare organizations in the United States were about as well positioned as any, for three reasons. First of all, we have a model that's been held up as a model for the healthcare delivery for the 21st century, which integrates across all of the various locations of healthcare. Secondly, we have built ourselves back from a very tenuous financial situation in 2000 to a strong one now, so that we can withstand some mistakes if we make them going forward. And third, we've learned how to change, and change fairly rapidly. And we've had an enormous number of changes over the years. We've changed how we're organized. We've changed from integrated to an integrated system. We've gone international, and we've about doubled in the last decade the number of physicians and number of patients we see. And all of that has not destroyed our culture. So I think that we can deal with new things as they come up. It will be a challenge, though, as it's going to be for everybody. Let's be really honest about this. This is the biggest change in healthcare that's happened probably since 1960. And it's an experiment that hasn't been done. Everybody asks me, is this a good thing? It's a necessary thing. Whether it ultimately is going to work perfectly, I doubt it. There's never been any legislation that has been perfect. It will be modified, I'm sure, as we go forward. But we don't know the outcome of this experiment, and it'll have to be played out before we know what results we're going to see.
Over the past 4 to 5 years, there's been a significant increase nationally in the employment of physicians by hospitals, including hospitalists, primary care, and subspecialists. Correspondingly, there's been a steady decline, as you alluded to, in solo and small group practice. Is private practice sustainable, or is it on its way out? Should I start looking personally for a buyer? How do you see the delivery of health care in a local area, in a smaller community such as Wooster, next decade?
Yeah, I think you're going to see a continuous movement to employ physicians. I don't think that we're in the interest of trying to drive physicians out of practice, but I think it's a trend that is going on starting about 5 years ago. It started to accelerate. There are going to be people who are going to stay in private practice and don't want to do it any other way. I think the vast majority of graduates from medical school now want to be in a practice and employed. And there's a number of reasons for this, and we stop to think about it. The first one is that healthcare now requires a lot of support, electronic medical records, etc., which is hard to afford. Secondly, it's become more and more complicated. The amount of knowledge in healthcare doubles every 2 years.